Institute. And today's webinar is in partnership with the Health and Environment Alliance, or HEAL, and the Center for the Study of Democracy. And as some of you know, the Health Effects Institute, or HEI, works on air pollution and health both in the US and globally. We focus on answering questions related to health effects of air pollution with a view to inform policy. And this has resulted in over 300 studies focused on a variety of questions related to exposure, related to health effects, and also health impacts of air pollution in countries around the world. We also spend time synthesizing and reviewing the evidence to understand the current knowledge and information. And in fact, we have a major review of literature of traffic-related air pollution and its health effects coming out later this year. So within the Institute, we also have a global health program that's focused on the synthesis of available evidence, access to data on air quality and health for countries around the world, and technical support and capacity building. About a year ago, HEI launched a project in Southeastern Europe with support from the Clean Air Fund, with the goal of reviewing and summarizing the available evidence on air quality trends, sources of air pollution, health effects, and potential disease burden in the region. And we are also focusing on Serbia and Bulgaria as two specific examples. And with the help of our regional collaborators, we will be publishing 3 reports between March and May this year, in which we aim to provide an overview of the status and trends of air pollutants and the associated health burden on the citizens in the region overall, as well as in Bulgaria and Serbia. So stay tuned. Within the project, we are looking to build local connections and networks among a variety of groups, including scientists, physicians, and civil society groups. And in this webinar series, this is among our efforts to continue some of those conversations on air pollution and health-related topics. So before we delve into today's webinar, just a few housekeeping announcements. There will be a 10-minute Q&A session at the end of the context setting session, and an opportunity for some questions at the end of the panel session. So please use the Q&A function at any time during the webinar, and we'll hold your questions until the Q&A sessions. And the webinar slides and video will be available in the upcoming weeks for this webinar. All of our previous webinars and slides are already posted on our website. And if you plan to post today about our webinar on social media, please use the hashtag listed here. And finally, so that we can improve our webinars, we'd be grateful if you could complete the post-workshop survey that will be emailed to you tomorrow. So we'll start today's webinar with a preview of the regional interactive database that we will launch later this month. Then we'll hear some brief remarks from our session chair, Garret Patrick Kelly, who will introduce the 3 speakers of the context setting session, who are going to provide some perspectives of how scientific evidence and other evidence influences air quality legislation and action, both in Europe and in the region specifically. And in the second half of the webinar, we'll delve into a panel discussion on this topic, moderated by Dr. Michal Krzyzanowski. So we have a very interesting webinar for you today with an esteemed group of speakers who will discuss how scientific and other evidence will influence air quality legislation through presenting a series of European, regional, and national case studies. 2 of the speakers will then join the two other experts for a panel discussion and bringing in their various perspectives regarding the use of evidence in informing both regional and national policymaking, both in EU and non-EU member countries. So as some of you may know, as part of this project, we will be launching an interactive and dynamic literature database, what we also refer to as a spatial bibliography, later this month. The database is geographically curated and designed to contain relevant research articles on air pollution and health, as well as reports and policy briefs from the region. We currently have more than 90 studies in the database. And as you can see from this, the literature is mapped by country, showing the number of articles in a gradation of blue, and with the darkest shade pointing to the country with the highest number of reports and articles currently in that database. So as you can see here, this is currently Serbia, which is linked to 39 articles and reports. And in addition to the geographic identification, the literature database can also be searched both by study type and health outcome. And before the official launch of the database in late February, we invite you to share any relevant publications with us, both in English and regional languages. This way we can ensure the completeness of the database, but it is dynamic, so we are going to continue to add to the database. So please email us at the address provided here on the slide, see@healtheffects.org. So now, without further ado, to lead us through the first part of today's webinar, it is my honor to introduce our session chair, Garret Patrick Kelly. Mr. Kelly is the principal at SEE ChangeNet and has 25 years of leadership experience in Southeast Europe, from UN ambassador to regional think tank director general. He has over a decade of experience developing and presenting high-level policy advice for decision makers in the European Union institutions, member states, the UK, Western Balkans, and Turkey, with a special focus on climate, energy, air quality, net zero emissions, and circular economy. Garret, the floor is yours for your remarks and introduction of the session speakers. Thank you.
Great. Thank you very much. Lesson number one. I should give you a shorter blurb for my bio, shouldn't I? Garret's got 25 years of experience in this stuff. I think that will do. And in terms of kicking off this, we've got three great speakers. Just to kind of frame what they're doing, Dr. Hannah Bogart is going to speak first. She's going to speak about the European perspective. And I think this is very important in terms of what Elaine has just said, because some of these countries that we're going to hear about, such as Bulgaria, are European Union members. They're part of Europe. And some of them, like Serbia and Bosnia, are part of Europe, but not part of the European Union. So Hannah will have to bridge that gap between the legislation that applies inside the EU and some of it that translates across. And then we're going to talk to Srđan. He's going to deal specifically with HEAL's challenges in Serbia of how to impact government policy by using research and data. And Constanza will be last, but certainly not least, because it's interesting that the energy transition in Bulgaria is coming up against this issue where clean energy meets poverty in the energy sector. So those are the three speakers. That's the flow of the narrative. But let me introduce you first to Dr. Hannah Bogart. She's got 15 years of experience in pollution epidemiology. She's a principal scientist at Health Effects Institute, one of the three co-chairs here. And while they're in Boston, she's cleverly positioned herself here in Europe. She's been an advisor to the World Health Organization, National Institute for Environmental Health and Science in Health Canada, and she's also the associate editor for a scientific journal, Environment International, and co-chair of the International Society for Environmental Epidemiology, and that's the European chapter of that. So, Dr. Hannah Bogart, I'm handing over to you for the first slide presentation, and you have 10 minutes, you'll get a 9-minute warning. Off you go.
Thank you so much, Garret. Let me share my slides here. Do you see my slides?
We do indeed.
Yeah, okay, super. Thanks to the organizers for inviting me. Let me start very broad. The European Commission has launched in 2019 the European Green Deal. Well, this is a very ambitious roadmap with the overarching aim of reducing CO2 emissions to make Europe climate neutral by 2050. So as you can imagine, this requires bold action at all levels and across all sectors, including energy, buildings, industry, agriculture, transport. Subsequently, a zero pollution action plan was published. Really, for the first time, pollution prevention and health arguments and basically reducing health inequalities are really front and center of this extensive plan. The other thing is that there's a much better appreciation that pollution doesn't stop at borders. Now, of course, all those plans and actions have huge consequences, not only for EU members, but also for states that are looking for EU membership and really beyond Europe, not in the least because there are large funds and budgets available for all this. Now, I'm going to talk briefly about two major evaluations that will shape air quality policies in Europe and beyond in the near future. So that is, and of course, what science has got to do with it. That is the revisions of the Ambient Air Quality Directive, as well as the new WHO air quality guidelines. So let me first start with the revisions of the Ambient Air Quality Directive. So how it works with the EU air policy framework is that basically it consists of three pillars. The directive, and it is sort of set out, ambient air quality standards, and it requires member states to assess the air quality in a standardized manner and to implement air quality plans to really improve the air quality. And the other pillars are dealing with emissions and emissions reductions. So now what's currently on the table are the revisions of the Ambient Air Quality Directive. So that is the first pillar. So you can appreciate the extensive process of those revisions. It includes open consultations periods with many stakeholders, of course, including HEI. Really, the goal of the Commission is to draft a new directive later this year. When that draft is published, of course, there will be time for negotiations with the Council, with the individual member states, as well as with the Parliament, which can take a few years. The ultimate goal here is to finalize the directive in the middle of 2024, before the next election cycle in Brussels. Really, the expectation is that the Commission will propose an ambitious new directive, and that they will propose to revise air quality standards so that they align more closely with the WHO air quality guidelines. The other thing is, if history is any indication, the real attempts to water down the proposal begins after a draft is published, particularly at the Council and the member state level. So let me talk briefly about the new WHO air quality guidelines here. Michal is joining us, so all the difficult questions go to him. But the guidelines were published a few months ago after years of intensive research and deliberations with experts across the globe. Really, the evidence base has extended significantly after WHO published its earlier guidelines. That was in 2006. So systematic reviews were conducted this time around, and also standardized methods were used for evidence syntheses, all with the idea to be as transparent and consistent as possible. Now, most of the updated health-based air quality guidelines are considerably lower, meaning the stricter than 15 years ago. And also of note is that the guidelines also include interim targets to guide the reduction efforts, because of course change don't happen overnight. The last thing, of course, here is that while the WHO air quality guidelines are not legally binding, they will influence air quality policy across the globe for many years to come. So as you'll see, the new WHO air quality guidelines are very ambitious. For example, the PM2.5 long-term guideline is now set at 5 microgram per cubic meter. The old one was 10 microgram per cubic meter, and the current EU standard is at 25 microgram per cubic meter, so much higher than the health-based WHO guidelines. Basically, same story for NO2 and other pollutants. So you'll see that the revisions of the Ambient Air Quality Directive is basically long overdue. Now, it's clear that the research has expanded quite a bit, especially research examining the health effects of low levels of air pollution. Now, HEI launched a large and comprehensive research program in this area, basically funding 3 complementary research activities in Europe, in the US, and in Canada. Each of these studies included millions of participants, and they applied state-of-the-art exposure methods. And the studies have just been finalized and results are being published. Now, the European study is really unprecedented. It analyzed many cohorts, including in 11 European countries. You'll see them on the map here. They analyzed not only mortality, but also many morbidity outcomes. They looked at PM2.5, but also other pollutants, including NO2. And at a very high spatial resolution, basically residential address level. And really the bottom line is that the study documented an association between mortality and air pollution at levels below the current EU standard, and really with no observable thresholds. Also, they reported a steeper slope at the low end of the exposure curve, and then sort of it levels off at higher levels. You'll see that in the figures. Of course, there is more uncertainty at the very low end of the curve and at the high end of the curve, because there are not many observations in those areas. And you'll see that reflected in the gray areas around the curves. And note that the average PM2.5 concentration in the European study was about 15 microgram per cubic meter. So those results were very consistent with the other 2 HEI studies investigating even lower levels of air pollution. So the US study had an average PM2.5 concentration of 11 microgram per cubic meter. And the Canadian study was even lower, with an average of PM2.5 of about 7 microgram per cubic meter. And all those reports are available on our website for everybody to use. So now that there's no safe air pollution level, and that basically every reduction in air pollution brings health benefits, is of course a very powerful message that needs to be communicated to the public and policymakers. So recently, together with ISEE and ERS, we have published a joint statement that was endorsed by more than 100 societies and patient organizations across the globe. Not only respiratory societies, but also the cardiology societies, as well as the cancer societies. It is not anymore that only respiratory societies care about air pollution. And really, we are trying to mobilize all stakeholders and to speak with a common and simple voice. So here, this is my last slide. What we are doing is we have meetings in Brussels and other places to really review the latest air pollution and health science to inform Europe's air quality policies. We've been to European Parliament to get the message out, and there are also early plans for another meeting later this year, where we engage with the Commission, where we engage with members of the Parliament, policymakers, ministries, NGOs. And really a quick shout out to Barbara Hoffman and Sorana Anderson and others from ISEE Europe that are helping in this effort. And really, lastly, in politics, timing is everything. So that's why we pay very close attention to the timeline of the revisions of the Ambient Air Quality Directive. So not only are we organizing meetings in Brussels, but we are also planning to engage in conversations with some important member states, because ultimately they will be the ones deciding. So thanks again very much for this opportunity. Looking forward to the discussion.
Thank you, Hannah. I mean, I can say one thing for sure. As we see that the indicators for what's an acceptable threshold for different particulates of air pollution goes down, pollution in our region tends to go in the opposite direction. But as you say, there is 9 billion of Green Deal funds coming to this part of the world in grants and another 20 billion in leveraged loans. So it's
Absolutely.
not as if there won't
Cheers
be,
to that.
yes,
Yes.
it's not as if there won't be until 2027 opportunities for us. So we go from the lofty heights of what's happening at the EU, and let's put in our diaries 2022 as an advocacy year in Brussels. And let me say to you at this point that if you want to ask questions, we're going to have 10 minutes at the end. Now we get to the cold face, excuse the pun. Srđan Kukolj, former Bosnian fellow of mine, now in Belgrade, and he is the second sponsor of this conference, HEAL. He is their consultant for the Balkan region, and he's going to talk to us about strengthening the public health response and the mitigation of the health impacts, I think, in pollution, especially in the context of climate change. And his story is the story of Serbia. Am I right, Srđan? Over to you.
Exactly. Thank you, Garret, and good afternoon to everyone. Today, I will speak more about the details about the air protection program in the Republic of Serbia. Most recently developed the document. So let me give you just a quick introduction at the beginning about the Health Environment Alliance HEAL. So basically we do work on the environment and health and actually safeguarding the human health and then our societies when it comes to the effects of the air pollution. When it comes to the our work at in the Western Balkan region, we do care about the air pollution and trying to estimate the damages and cost of the air pollution, meaning how much that's pretty much that we have, how much the cost, the public health in general, economies in the general, and how many diseases have been occurred during the massive air pollution across those countries in the region. So most recent activity that has happened is actually the development of the air protection program with the action plan in the Republic of Serbia. So the presentation that I have, I will start with giving you the short introduction about the transparency, I would say, about the process, because the Ministry of Environmental Protection and supported by the EU delegation to the Republic of Serbia has decided to organize 3 separate conferences or meetings or consulting meetings to give a chance to the broader audience to get closer with the development process of the air protection program, and to also invite the audience to participate in providing the comments and suggestions regarding the development, the further development of the program. So those 3 meetings being organized during the 2021. And we found out that, I guess, the 2.5 years that this program is going to be developed. So basically, the HEAL has decided to basically do monitoring of the development of this program. And that was the moment when we had started the communication exchange with the representatives of the Ministry of the Environment Protection and the EU delegation to the Republic of Serbia, and really trying to push hard when the health agenda into this environmental policy document, and basically have this ongoing back and forth communication, and then sending a lot of questions regarding about who's being a part of the working group, who's going to work and who's going to develop the document in the future. So the Ministry of Health has established a working group of 19 members, and just 2 of them actually representing the public health sector. One of them is representative of the Ministry of Health of the Republic of Serbia, and the other person is the representative of the Public Health Institute in Republic of Serbia. So we have participated in these consulting meetings during the 2021, and we found that the general population is not really familiar with the development of this program, and that was the reason why we decided to develop or write the blog post about the development of this program, and to send, I would say, the public call to the health experts to be engaged with the development process and also support the Ministry of Environment and EU delegation to include more health aspects of in this document. So also the next step was the sending the official letter to the Serbian Health Environmental Ministries, actually highlighting the engagement of the health representatives and actually increase the ministerial and sectoral cooperation, because we had the strong position that the Ministry of Health should be more involved in the development of this program, because it's about air pollution, and the science is telling us that air pollution is affecting the human health a lot. So we was really highlighting the importance of engagement with the more health experts in the process of development of this document. I would have to say that this document is still at the stage of the draft. It's publicly available, so you can just simply Google it and you will find the last version of the draft. Luckily, we got the response from the Ministry of Environment, who actually assure us that they are really doing hard regarding the development of this program, and that they have had a chance to engage with health experts who help them to provide more knowledge and science knowledge about the further development of this program. And in November last year, we sent our final letter to the Ministry of Environment and the EU delegation, actually providing the comments on the program and giving the suggestion what should be improved in the future. Please keep in mind that the document has a total of 181 pages, and maybe this presentation is going to be a little bit confusing to you, but however, I'm inviting you to download the document and go through the document. So I would give you just a brief introduction about the vision of this document, which says that Serbia has to ensure that by 2030, everybody should be able to enjoy the clean ambient air. And the objectives, the general objective, of course, is to reduce the health damage due to poor air quality by 2030 compared to the 2015, and also reducing the exposure to the air pollution by also limiting the damage on ecosystems. Those four specific objectives are talking about the specific emission reductions when it comes to the SO2 and PM2.5, pollution, about the emission reduction from the industrial and agricultural sector, and also to promote transition to clean air for everyone. The last sentence that you can see at the slide, which is highlighted in yellow, says that the word health has been mentioned 80 times, which is very surprisingly good. Our task is also to do the legal analysis of all legal documents across the region, and we found that all of these environmental policies are missing the health. So we are very happy to see that the development of this document includes a lot of aspects of health when it comes to the environmental health impacts. So the table of contents of this document will give you a short introduction of the specific parts of the document, where you can find more information regarding the health and environment. And you can see that there is details about the cost and health environmental impacts of mitigation scenarios that I will speak a little later, about the health criteria, which was part of the questions based on the technical information provided in the accompanying documents. When it comes to the action plan, there is the information about the weight of the environmental, health and economic criteria used in the multi-criteria analysis. And the C scenario, which will be also explained a little bit later, is talking about the aggregated annual health damage due to poor air quality in Serbia, and aggregated annual health benefits due to implementation of the different mitigation scenarios. And also there is two tables telling us more about the estimated health impacts due to current ambient air quality in Serbia, and annual health impacts by scenario. in, of course, respective minutes and year. So this slide is not okay because it had a lot of text, and I'm not invited to read and go through all of this that you see at your screens. But I will I really want to highlight this because this is the introduction at the very beginning of this document, and it's telling us a lot about the effects of air pollution on human health. It's telling us about the damaging effects of the air pollution, about the premature deaths, about the chronic diseases, about the most affected population. So we are very happy to see that I would say that the mostly environmental oriented document is starting with this health informations and telling us and sharing the science about the effects of the air pollution on human health. So when it comes to the pillars of this document, just for information, the base year used for the expression of the reduction of air pollutants reduction is 2015. And the program itself covers the period 2022-2030. And those pillars are about air pollution and mitigation scenarios, about the cost and benefit analysis, and also about the assessment of health and environmental impacts associated with mitigation scenarios. However, you should know that for the program purposes and the achievements of the air quality vision of this program, and in addition to the baseline scenario, there are three quality mitigation scenarios that I will speak about. And also all scenarios are developed using the models that are also used for the definition of the EU targets and pathways up to 2020 and 2030. So there is a baseline scenario, but most interesting for you will be, of course, talking about the three different scenarios. The first one, the A scenario, is the full implementation of all relevant EU directives and regulations related to ambient air quality, not yet fully transparent and implemented, which is like the scenario that we don't like the most. The second one is called like intensive control scenario, and it says that in addition to scenario A, introduction in some cases of strict emission limit values and introduction of national, financial, and fiscal policies and measures in key emission source categories, such as scraping and promotion schemes for passenger cars and household or food or coal appliances. And the last scenario that we support the most is the full control scenario, which means that in addition to scenario B, all necessary measures, including local specific measures such as incentives, restrictions, and bans, aiming to ensure compliance with the limit values as defined in directive focused on ambient air quality and cleaner air for Europe. For your information, all air quality mitigation scenarios are building on the M2 climate scenario as prepared in the process of the preparation of the Serbia low carbon development strategy. And also considerably deviate Serbia emission trajectory from the basic baseline scenario.
Can I wrap you up there, Srdjan? Sorry.
Okay. So just to give you the short preview of the letter that we sent to the Ministry of Environment, we said that the Serbia program needs to include a clear pathway and ambition timeline to reaching the 21 WHO air quality guidelines. Also, the forcing vision of the clean air 2030 will only be achieved with the setting of swift goal phase-out date. A more integrative approach should be considered, requiring the work together with the various ministries and sectors in reaching the stated clean air objective, also considering the Green Agenda, Western Balkans, Sofia Declaration, and many more documents that are being followed by this Green Agenda. All relevant EU legislations needs to be speeded up, not delayed, like in the case of IPPC law. And the program and action plan have to be legally binding in order to drive the necessary and overdue changes for a cleaner air. So what is missing is the lack of more participation of external expert teams in drafting the program, also the participation of the national scientific community and academia, especially meaning about saying about the health representatives. And also we expected that the members of the working group who are representatives of the Ministry of Health and Ministry of Public Health, had organized a series of meetings, or at least one meeting with the key stakeholders to share the knowledge, scientific knowledge about the development, regarding the development of this document. And of course, we expected that the Ministry of Health would play some significant role in the development of this program. And the last slide is about that. The next step is the formal adoption of the by the government, but no date has been set yet. So stay tuned, and of course, I hope that the government will legally proceed with the legal adoption of this document. Thank you very much for your time.
Great, thank you, Surgeon. Sorry to keep you to time there, but we should be fair. We had a few minutes. And I see that we've got 78 participants. I just want to tell you that if you have questions for Surgeon, or you have questions for Hannah, or you have questions for Constanza, you just need to click on the icon on the bottom right of your screen, Q&A, and you can write them in. And we'll try and go through any questions that come up for any of the three speakers as we go on. Okay, so you can see from Serbia that they've managed to make this link between health and pollution impact, and that they're in the stage of the review process to get these kind of standards into law. And now we're going to talk briefly about a third aspect of this, which is about the link between trying to reduce air pollution while also dealing with the issue of energy poverty, because as with many things to do with poverty, it's the poorest people who come out the worst in these transitions. So this is Konstanza Rengalova, who's a senior energy and climate analyst at the third sponsor of this presentation. She's from the Center for the Study of Democracy, our great partner in Bulgaria, who we've been working with for many years. And she's doing the politics and economy of energy transition. And before that, she was director of research at JBC Energy in Vienna. So she's got a bit of the European private sector background as well as the policy background in Bulgaria. So without further ado, I hand over to Constanza. It's all yours.
Many thanks for this kind introduction. Let me just share my screen first. Here we go. So thank you everyone for joining us for this webinar. As you can see in the next few slides, I will talk about the Bulgarian perspective, and I will try to answer the question, why is there no effective policy coming up, despite that there is plentiful scientific evidence telling us that air pollution is killing people. And I'm going to focus primarily on the topic of energy poverty and its connection to air pollution, and try to explain the main shortcomings in the policymaking process in Bulgaria that we are currently facing. Now, the link between science and policymaking is at the heart of what the Center for the Study of Democracy does, and our mission statement is building bridges between scholars and policymakers. So just a few words on who we are, in case this is the first time you hear about the Center for the Study of Democracy. We are a public policy institute operating since 1990, and we are based in Bulgaria, but our expertise focus extends into all of Southeast Europe, and we have a wide network of informal partners that we work on, including on EU-funded research projects. Our topical focus is very diverse. We have 5 different departments working on economic, but also security, legal, and social issues. Personally, I'm from the energy and climate program, but we all work together in a synchronized fashion. So our approach is really interdisciplinary. So to bring you back to the topic of air pollution and why the policymaking process in Bulgaria is facing some issues. Now, I wanted to start by showing you a picture that the director of our economic program took from his window in November last year, so relatively early autumn here. And what you can see in the middle here is that the horizon is missing. And this is something that happens every year in Bulgaria. So whenever we get a little bit of a colder weather, we have every household burning, that is especially from the poorer side, starting to burn coal and firewood to keep their homes warm. And as a result, this exacerbates the pollution problem that we already have from other sources such as traffic or industrial areas. And during this time, we also have the news being flooded by people complaining about, we have the third day, the second day, the fifth day of extremely polluted air in Sofia. We have protests, but then nothing really gets done. And I'm showing you this just to emphasize that even without scientific evidence, just looking out your window, you can diagnose that there is an air pollution problem in Sofia, and it's a very tangible reality for people, especially for those living in urban areas. And even though they may not know how likely they are to die from air pollution, they can definitely choke on the bad air. And the reason why this does not translate into a policy momentum that leads to better air quality policies is the nexus between energy poverty, decarbonization, and air pollution policies. And then, so basically, the public debate in Bulgaria is shaped in a way that we are facing the argument that either clean air and decarbonization policies cannot move forward because of energy poverty, because we cannot forego energy poor people, or that even energy poverty is a reason why we need to reverse current decarbonization policies or clean air policies. So it's a very vicious circle that we need to escape from. And there are several problems in terms of the policymaking process that result from the way that the public debate is shaped. And the first one is related to decarbonization itself, because as you know, air pollution and decarbonization are very closely linked in terms of topics. And we have a severe lack of ambition in terms of decarbonization policies in Bulgaria. And what you can see on this chart here is with our latest National Recovery and Resilience Plan, the measures that are included in this plan, if we implement them all, what would happen in terms of greenhouse gas emissions. And what our modeling assessment showed is that we would not reach carbon neutrality by 2050, which would be in line with the European Green Deal. And what you can see on this chart in particular is that, first of all, we have some reduction in terms of the emissions from the energy sector, which is the red area here, but they're definitely not sufficient, and it still accounts for a very big chunk of emissions already also in 2050. But most importantly, if you look at the transport sector, which is the blue area at the bottom, the building sector, which you can barely see here, mainly because the building sector is very much connected to the energy sector, and also the industry sector. So these have barely any change between now and 2050. And this reflects the fact that there is very little ambition from the National Recovery and Resilience Plan in terms of measures that will reduce emissions and will have a meaningful impact on these sectors. And basically, this is number one. So we don't have a clear, ambitious national strategy for decarbonization. Number two, in terms of what we are missing in terms of the policymaking process, is that we also have counterproductive policies. And this is also very much related to decarbonization. So in the energy sector, we have very limited ambition in terms of phasing out coal power plants, which, as you know, are a big contributor in terms of air pollution, especially in the Balkans. And in Bulgaria, we have this popular and widespread myth that if Bulgaria closes down its coal power plants, we're going to have blackouts, and it's a huge issue for energy security. However, our modeling assessment has shown that we can close most of the coal plants by 2025, and this is going to be the most beneficial way forward for Bulgaria, because we are not going to have subsidies going into the sector, and we're going to have less pollution issues. And just on the subsidy aspect of it, what you can see on the left chart here is the amount of subsidies that go into coal power plants. So not even coal mines, just the coal power plants. We have, for the 2021-2022 regulatory period, we have over 600 million euros going in different forms, but as subsidies for coal power plants. And this represents about 1.5% of our GDP. So you can see the magnitude of support that goes for coal power plants, even though they're not essential to our energy security. And the second example of a counterproductive policy is related directly to energy poverty. So we have subsidies that incentivize households to burn coal, firewood, and fuel oil for heating because they pay for households to buy these fuels. So we have, again, a counterproductive policy that actually leads to higher air pollution without doing something to really resolve the issue, which would be electrification of buildings, changing the heating devices that people use to heat their homes. Speaking of which, this brings us to number 3 in terms of public policy issues that we currently face. And I decided to name this institutional responsibility. And under this, there are 3 main elements. So the first one is strategic vision. And this relates to one of the first slides that they showed you about decarbonization policy. For air pollution, we do not have one big governmental plan about how to tackle air pollution that is very strategic and proposes specific actions on how do we get there. Second of all, it's coordination. So each of the 6 regions that we have in Bulgaria has to devise its own air quality program, all the same without having this strategic vision that I earlier talked about. They have limited funding to devise any kind of strategic program. And at the same time, there is no mechanism for them to coordinate between each other what they're going to do to tackle air pollution in this region. And finally, we have the problem of accountability. So this is, there's 2 key elements to this. The first one is that measuring air pollution in Bulgaria is very limited. So we have very few measuring stations. Most of the time, they do not work. We have a website where they report, they are supposed to have daily reports about the state of air pollution, but for many dates you do not have the data, it's not generated. There is also very limited way to search through the data, so you can only look at one specific day to see what the state of air quality was in that specific day. And also there is very limited sanctions for what happens if this limit is being exceeded in a systematic manner. So for example, Sofia municipality and Plovdiv municipality have both been convicted in court for negliging air pollution in these municipalities. So basically for inaction and for lack of specific sanctions for air polluting entities. However, this has not resulted in any actual consequences for the municipality. So these are more symbolic in terms of court decisions. And last but not least, we have the issue of accountability regarding the actual strategies and air pollution policies that we have on the regional level. So what you have on the left side here is Sofia municipality. It's depicting the lack of success of a Sofia municipality policy for replacing heating devices for households. So initially
Sorry,
yes.
I'm just wrapping you up there, okay?
Yes, of course. So the key point here is that we had 5,000 homes were supposed to get their devices replaced. Only half of them were actually scheduled. And of the scheduled replacement for heating devices, we have less than half of them being actually with a scheduled date or already installed. So we have a very small number of actual replacements happening from this specific policy. And just to conclude with my final slides regarding the role of shaping public debate. So just a small reminder about how the share of air pollution in Bulgaria is really severe. Here you have a chart showing the share of urban population that is exposed to air pollution issues. And you can see that it's really high throughout several years. And the main message here is that we have energy poverty and decarbonization being shaped as barriers for building, basically they're facing energy poverty as a barrier for moving forward. But in fact, there are many policies that can be done that actually solve all three of the issues. And these policies are focused on renewables and self-consumption, but not big renewables projects, focusing on small scale on households, making people install solar panels on their roofs, energy efficiency, and finally, shared mobility. Thank you for your attention.
Top stuff. Thank you, Constanza. Since there isn't yet a question there, I'm going to ask the two of you a question based on who was it now who gave us this question that I'm looking at up here? Gordana Grujic. So this is a question for you, Constanza, and you, Srdjan. It seems to me that Gordana Grujic wrote in the question here that there's the structure of taxes on importing old cars is such that the older and more polluting car is less taxed, perhaps, than a newer and more efficient car. And in your case, it's the people who are most poor are getting subsidies to keep burning the dirtiest fuel, right? So I'm wondering, is there some kind of filter? You know, they always have in government policy centers, when they're doing them properly, a budget review to make sure that it's value for money. Should they in Serbia and in Bulgaria also be having an emissions review to make sure that not just in air quality, but in farming and in building and in importing and exporting, that there's going to be, you know, check first, is this going to reduce emissions? Do you think that's a crazy idea or necessary? Srdjan, we'll get from you first and then Constanza.
Sure, thank you for your questions. Well, I mean, we have questions about the transport here, which is really important questions, especially when it comes to the countries in this region. We have a lot of huge fleet of very old vehicles and also polluting a lot. But I would say that we have the national reports regarding the air pollution, and we've seen, the very different data talking what's the key source of the air pollution. And some countries are telling that it's the households heating. Someone is telling that the transport or agriculture or the industry. I think that the revision of the pollutants or the data in general should be done. I think that the government needs to put more subsidies into the renewable energy, and when it comes to the transport, we want to see more public transport vehicles rather than the passenger cars. We recently have published the 4 different briefings for the cities in the region. You can go to our site and you will find those information. And for example, in the case of Belgrade, we have more than 700,000 passenger vehicles and about 1,600.
Srdjan, can I ask you a question though?
Yeah.
You can imagine that if they're decarbonizing many of the European cities by 2025, 2030, they're talking about getting rid of all their vehicles, that there's going to be a massive exodus of of gas-fired burners, of old cars coming out of the European Union and into the region here. And I'm wondering, is there anybody looking at the idea of having a fiche, a check across all policies to make sure that they're all at least emissions neutral, if not emission reduction positive? Is there anyone talking about that in Serbia?
Not really.
No. Okay. Constanza, what about you?
Yeah, I definitely don't think that this is a crazy idea. It's actually a great idea. And this brings me back to the research I was doing to devise this chart about the municipality changing of heating devices. Because what I had to do is go through several different Excel sheets that had the scheduling for the program for replacing of heating devices. And they were not uniform, they were not filled in the same way. So it was extremely difficult to actually extract meaning from this data that is already provided by the government. So there needs to be collection of data about and performance indicators about whether the policies work and what is actually missing, and trying to figure out where the problem is. So definitely this is something that needs to be talked about more, but unfortunately it's not really something that is on top of the agenda, at least in public debate.
Okay, I think it's probably something that I notice here in Bosnia and also in Macedonia as well, that they have all these energy efficiency programs sponsored by the World Bank, the UN, UNDP, and we've just done an audit of their greenhouse gas emissions, which we got from their energy balance. And we see that they've, in spite of all these demonstration projects, that their energy consumption has been going up by 2.5% a year since 2008. So practically every policy intervention they've made is not having a net reduction impact. I have one, I have to hand over in 1 minute. So I have one written question from Alison Patton, who says, thank you for your informative presentations. Well done, people. How can the experience from Serbia's work on air protection program help inform other actions in other countries in the Western Balkans? I will answer this one. Alison, there is a lot of work going on, not just in Serbia. I think Macedonia were the first people who started using apps which told you what was the air quality outside your house. There's been extensive protests in Kosovo about the coal plants which are very near to the capital in Pristina. Here we have just submitted to the European Commission a proposal to become a net zero city in the next 10 years. And in Montenegro, at Plevlje, they're trying to do a just transition project. So I think that we are all learning from each other. I mean, Constanza, Srđan, me, and Vlatka, everybody else who's working in this field are sharing information all the time. And I think it's great that that this database has been opened. And now that I know you're collecting documents from the region, I'm going to start adding a few for Bosnia as well, so that we will increase the number of reports from there. Okay, we're exactly at 3:25, which is when I promised that I would hand over. So I want to thank first Srđan, Constanza, and Hannah. Say you did a fantastic job. All of their presentations will be available on the website where this was, and I'm handing back now to Elaine.
Excellent, thank you. Garret, can you see my screen?
I can.
Okay, great.
I mean, I can see you, but what I see on the screen is panel moderator. It's Michal.
Yes, perfect. No, that's great.
Okay.
Thank you very much, Garret, for leading this really important discussion, and to the speakers for providing us with your new unique perspectives on the European policies and interventions, also the regional and national, and really setting the stage nicely for this next part of the webinar. It's now my honor to introduce today's panel moderator, Dr. Michal Krzyzanowski. Dr. Krzyzanowski is an environmental epidemiologist holding an honorary position of visiting professor at the Environment Research Group at the School of Public Health of the Imperial College London. He is active as an expert consultant for WHO, UN Environment, and other organizations, including as a member and co-chair of the WHO Guidelines Development Group, as Hannah mentioned. Michal is also a member of the HEI Global Health Oversight Committee, and until 2012, he was the head of WHO's European Center for Environment and Health. Sorry. Michal, the floor is yours. Thank you.
Hello, good afternoon, good morning. I hope you hear me. It is my pleasure to chair the panel in this very interesting meeting. We'll have 4 panelists, and we'll also have some time for discussion or questions and answers. So stay tuned and be ready to intervene. So I will introduce the panelists first. The first panelist is Daniela Bozanic. She worked in the Serbian Ministry of Environment and Climate Change for 15 years, and since 2018, as a founder of the Climate Action Consulting Company located in Belgrade, she provides guidance and conducts data-driven analysis for policy and legislation planning and implementation in the West Balkan countries. The second panelist is Stefan Ahlström, who is a senior researcher and project manager at Swedish Environmental Research Institute. Since 17 years, most of Stefan's research is oriented towards the integrated area of economics and air pollution, with a special focus on co-benefits and trade-offs between air pollution policies and climate change policies. Stefan is currently a co-chair of the Task Force on Integrated Assessment Modeling under the UNECE Convention on Long-Range Transboundary Pollution. And two further speakers you already met. It is Konstanza Rangelova. She is a senior energy and climate analyst at the Center of the Study of Democracy, and as you heard, she represents one of the co-organizers of this webinar. And Krzyzanowski from Hills, who is Hills consultant for the Balkan region, and he is also a co-organizer of this meeting. So with those introductions, I will ask all panelists to tell us briefly in a few minutes, where there will be two rounds of discussion. We'll be talking about the evidence and how the scientific and other evidence is influencing policymakers. We got already a brief introduction in the setting the scene session, but now I want to focus on your experiences from your practice on what works and what doesn't work in using the evidence for policymaking. So with this question, I am asking Daniela first to tell us what is your experience. Please go ahead.
Thank you very much. So I will try to be quite brief and to just give you a flavor based on experience of Serbia, but also in the countries of the region. So like all the previous speakers mentioned, you know, the basic thing for any kind of science is the data. So when it comes to data, you know, and the national network, and especially in the field of air quality, it seems that all the countries has enough stations, I mean, you know, places where the measurement has been making. However, from the perspective of health, it seems that data on the elements that are the most harmful for the health, as a matter of fact, missing. Additional thing that is quite challenging here in the region is QA/QC. So even if we have available data, even if the data, you know, are presented on appropriate way, their quality is very often quite challenging. So in that sense, we have data enough data for making a basis for planning. We use more or less starting from quite huge donation from the EU, you know, modeling. So I think that Stefan will mention that briefly later. And we have involved scientific institutions and universities in this modeling. So my feeling is that those has enough experience, and we have in that sense capacities that lacks, as a matter of fact, and lacking into governmental institution. Unfortunately, when we have, you know, some external, I mean, foreign expertise, they try to find scientists and universities here to be involved into modeling. So those are things that we have, and seems, you know, that this QA/QC, sometimes availability of data and stronger and more efficient involvement of science and policy making has been lacking.
Well, thank you, Daniela. Indeed, so already in the presentation, previous presentation of Krzyzan, I think he underlined that the involvement of scientists, and especially from the health perspective, was not sufficient internally in discussion of the Serbian program. So I think it is important what you say. Okay, the next one is Stefan Ahlström. Stefan, what is your external point of view?
Yes.
Tell us big picture or bird's point of view.
Yeah, the outsiders coming from the convention perspective quite much. I took the chance to talk to some colleagues on the European Environment Agency, etc. And I must say, I mean, the picture, I agree with Daniela. I mean, there has been in plenty of countries really large progress in the monitoring of air quality. And when I look at the list, can actually see that some countries are doing better than Sweden, where I come from, which is terrible being a Swede, but I'm very happy for you guys. But there are also some countries, again, that do not have sufficient monitoring. And again, bear in mind how science can support. I mean, where at the end of the day, it will be important to validate that the policy initiatives you take has an actual effect. And the only way to do that is to have monitoring data. And that's where some countries still, I don't feel the need to point names, but some countries still need to do better so that decision makers basically can show that their policy initiative has an effect, that they can show that this has had an effect on air quality. And that's why it's always important with good quality measurements. So it's my outside view is that it's becoming much better, granted with support from EU and EEA, but this progress is very unevenly distributed over the Southeastern European countries, I would say. That's where I think I can stop for this question.
Thank you, Stefan. So it is a circle. I mean, without data, we cannot make good policies, and we cannot appreciate the magnitude of the problem. But what I hear, we do have sufficient amount of information to recognize that the problem exists. And now when we move to solving the problem, hopefully, we need to measure the progress. And here we again come to the data. So it is essential. Okay, next in the panel is Constanza. We heard from you already, but can you tell us again give your personal perspective, how you see the things, what works and what doesn't?
Yes, definitely. I would like to start with what doesn't work. And I think that what doesn't work is data without a clear message and an action plan. So basically turning data into actionable information. And this means that we need availability and accessibility. We need relevant data, but it also needs to be shaped in a way that it's accessible in terms of, even for lay people, that it delivers a message about what this means in terms of what needs to be done. So basically, we don't only need the evidence, but we also need to translate this evidence in an easy to understand way for policymakers that is convincing and that tells them what they need to do, why they need to do it, and then enabling other actors also to use this evidence and build networks of that has the capacity to influence the policymaking process. So I think this is basically the point where the data becomes to work productively in shaping policies.
Okay, if I may continue this is extremely important point. I mean, we can sit on a pile of fantastic data which is not understandable to policymakers, or to also how you see it, to whom this data should be understandable, to average citizen or to the Minister of Environment?
I think it should be understandable for everyone, but it also needs to be tailored to the specific audience. So this is definitely something that the Center for the Study of Democracy is very active in. So basically taking scientific and academic work and translating this into a policy brief that in 3 pages tells policymakers, this is what the data is telling you, and this is what you need to do to solve the issue, and this is why you need to do it. And then for lay people, what you need is interactive tools that make the public debate evidence-based and inform the public about what the issue is, and this builds the momentum for the political pressure for sending a given issue at the top priority list in terms of the policymaking process, because you need both the general public to have this issue at its heart, but also the policymakers to really understand what they need to do to tackle the problem.
Okay.
Could I
Thank you.
come in, Michal?
Yeah, please go ahead.
So I'm also realizing one thing which I wrote down from the excellent presentations earlier on the Serbian action plan, where the action plan did not have anything on residential heating for Serbia, as I saw from your presentation. And also that what Constanza said, that Bulgaria subsidized coal and fire fuel use for the residential sector. Here is a gap that, to my understanding, and basically using my nose when I go down to Southeastern Europe, lots of the problems with urban air quality, as Daniela mentioned, Daniela mentioned, that it comes from residential heating. And why isn't that key or a centerpiece of air pollution policy? And this is where the science communication in some way must have failed, for lack of a better word, because that's not what the science tells you, at least not that I know from the science I've read and from my own experience, which confuses me a bit. So there, I think it could become better uptake of the science. And I also would like to add, I'm just realizing that we in the convention work, we have been doing estimates of the, well, I'm an economist and we try to put money values on everything. And there's quite a few of us, and we have summarized some numbers for Europe, including Southeastern Europe. And the thing is that in monetary terms, so this is where you can speak with the finance department all of a sudden, which when it becomes interesting. So the damage cost to these economies is basically somewhere around annually 4 to 10%, or even in worst cases 14% of these countries' BNP, or sorry, gross domestic product, not talking Swedish, but the impact or the welfare effect of these health effects is enormous. And I would bet my right arm that just from the increase in work hours, increase the number of days that people can go to work and be productive for the economy, as a consequence of cleaner air, would be more productive than the costs of cleaning the air in these countries. That's my guesstimate. But what we have looked into in the numbers, it's in big numbers in terms of effects on the economies in these countries, as well as other countries. I can put the link in the chat to this draft report. It's available on the Air Convention site. But I think that's an area where the science can reshape its way of communication. Sorry, that was a long rant, but I just felt the need.
Yeah, but there's a good point, and actually it's also helping. I see, Daniela, you raise your hand, but I would like to ask first Srdjan to respond to say, first of all, what he thinks, what is working and what is not working, but also to respond to Stefan's question, because I have seen in your slides, Srdjan, that this preparation of the program in Serbia was included cost effect analysis, if I remember, and impact assessment. So perhaps you have those numbers which Stefan was telling about, and please tell if they were making any impression, or if they are making an impression on decision makers. Srdjan, please go ahead.
Yeah, thank you. I will respond to certain questions. First, about the household air pollution. I think that the topic itself is very important, and we've been discussing a lot across the region, and we've seen that some of the governments being reported that this is the major source of the air pollution in the region, and there is a lot of initiatives actually running at the same time regarding the changing the stores, or just, you know, better equipment when it comes to the households. But one of the things that we've seen is changing, especially speaking about the Serbia, is that the country is trying to decentralize the way of the air quality management, which means that they're, I would say, ready to deploy the budgets at the local level, which could be a good case, and because we have like very specific sources of the air pollution from town to town, and, you know, from the region to region. So basically we can, of course, we should have this umbrella policy or strategic documents as the air protection program or law or bylaws and so on, but still the important thing about the effects of the air pollution on health is we also send a message to the Ministry of Environment and the EU delegation that we want to see more health experts involved in development of this program, because also these people will be responsible for the implementation of this program and those actions that will be happening in the future, and not only about the health experts, but everyone who will be responsible for the implementation. So we do understand that it's very important that, you know, intersectoral cooperation should be increased a lot than it's at the moment, and not only between the different ministries and the stakeholders in the country, but between the region, because we have to speak about the transboundary air pollution, especially talking about the coal fleets that we have, and of course the household heating. So I think that the change is happening, but it's not really fast, and we do expect that the EU delegation in each country and the EU Commission itself to really boost the transition, and we hope that this funds that we are expecting to the Economic and Investment Fund is going to be spent very well regarding the decrease of the pollution.
Okay, thank you, Srdjan. Well, I must say I was pleased to see you are talking about multi-sectorial collaboration and recognition of the problem by various sectors, and I was pleased to see that in your national plan there was a plan to cut ammonia emissions from agriculture. There's maybe not as a visible problem and not so well recognized problem as domestic heating as a source of pollution. But I think it is also, not I think, I mean, Stefan can confirm that a lot of pollution and a lot of exposure in Europe comes from ammonia emissions from agriculture, which until now was a sector which was kind of put aside and not considered to be an important sector. But it is very important, and you also mentioned this issue of domestic heating, and I know it also from Polish and from other situations that it's such a big problem and so dispersed problem that it's just paralyzing the authorities when they try to approach this. So it is an issue of perception or the governance, who should do what and for whom. So it is an issue, we'll probably park it for a second, because we have Daniela, you asked to make a comment first, and then I see Garret raising his hand. Daniela, please.
Yeah. I just want to mention, that when it comes in general, with data and capacities, when it goes to local level, somehow it starts to become worse, and that has also certain connection with this program that Srdjan mentioned, because the program is on a national level, and it doesn't tackle a local level, of course, because it cannot do that, and then, local communities do not have enough data, do not have enough capacities, to downscale those programs, you know, and put it at the local level and to try to do something on in that regard. And then also, which I need to mention, you know, you saw from the surgeon's presentation that, and he mentioned also that, as a matter of fact, health has been mentioned in the program, but it's not a driver, you know. And the similar situation is, you know, when it comes to air quality and the climate change, you know, those are not drivers for sectoral strategies, you know. They just mention something. They just put the current state in regard to the air quality. And then we have one very funny situation, for example, in Serbia, you know, when it comes to this coherence between, you know, and the purpose of the climate change and the air quality, you know, policies. And in general, you know, topics. We use now climate change as excuse for bad air quality, you know. So that is really, you know, funny thing. Yeah, we very often lack these cost benefits, you know. So this is the main point. Without cost benefits, we do not be at the right pathway. And finally, which I need to underline, yeah, households, agriculture is, you know, waste is quite important emitter when it comes, you know, to air quality, when it comes to climate change. But do not forget, we're speaking about the countries which energy production rely on thermal power plants, I mean coal. So for those countries, the biggest issue is thermal power. So, you know, just not to forget that. So I will finish with this.
Yeah, you just, thank you. You just mentioned cost benefit analysis, so that we know what will be the benefits of implementation of the actions with a certain cost, of course. I mean, nothing comes for free. Garret, your hand is up.
Yes, thank you. I want to come back to the cost benefit analysis. I think for certain groups of people, let's say, especially in the health sector, I think that the main communication pathway for the general public to start with should be morbidity and mortality, because they understand when their grandparents are dying or having very poor quality of life. They understand when they have to stop going to work at 60 because they can no longer. These kind of impacts are very important. Morbidity and mortality ones, I think, are the key data for communicating to the general public. I honestly am not convinced that the governments of the region really care very much if the impact on their health sector and their economic sector is reduced by X amount of hypothetical, because they're already hypothetically not, they're in power, and they will be in power for 4 years or 8 years. And these policies will take much longer than that. So this work is important to do, but it's very important in communication terms to do that line of morbidity and mortality. And the first thing I would say there is that it would be good to disaggregate the trends there, because we found that in Bosnia, they're very concerned now, especially in cities, about pollution. And they think it's dangerous, but they think it's only dangerous to children. And they care about their children. They are not looking at the impacts that this is having on other vulnerable categories, as they've understood from COVID, because the people are dying in front of them from something that they can test for. Yeah. Whereas they don't diagnose properly yet in medical records reason of death or reason for medication related to pollution. We're trying to do an epidemiological study on that here. That's the first thing. And the second thing, Claudio Bellis there from the European Research Centre is talking about the environmental information. I do believe there is enough environmental information out there. I do honestly think that there is quite a lot of air quality work going on in the region, and that if people have PM10 instead of PM2.5, people are extrapolating. I think that Heal did a great desktop morbidity study, I think for Tuzla. Vlatka will correct me on that. This is very important. Telling people how many people will die, morbidity and mortality, shortening of life and death, very important communication strand. And I think that's where I would be going. And then the second strand of that is speaking directly to health professionals and saying, because they understand, the public understands now from COVID that being overwhelmed is a cost. So if you're overwhelmed in the winter months with people that you have to treat because of asthma, because of heart attacks, etc., you're not able to do the other kind of care that you would normally be providing. I think this is a pathway for cost benefit analysis. Okay, I'll stop there, sorry.
Okay, Garret, thank you very much for your contribution. You actually responded to my second question, I mean, to the question which I want to ask the panel members. I mean, that was your position. I mean, secretly, I agree with you, but I want to hear from the panel members. You mentioned information, you mentioned data, you mentioned evidence, but you not always very clearly identified what type of evidence, what type of data need to be communicated. I mean, we heard already that it has to be communicated properly, but Garret made a very strong point about communicating health data, or not data, estimates about impacts of air pollution or estimates of changing potential improvement of health if we make some changes in the environment. Is it the evidence you see as lacking, or as evidence which has been is not available or not delivered properly? So please, perhaps in reverse order now, I will ask Srdjan, what type of evidence you would like to see more in this discussion with politicians and with the public and all other sectors? What is missing? And is it missing really, or it is just not being used? Srdjan.
Thank you. I think that I could agree with Stefan and Daniela when it comes about the monitoring of the air quality and the quality of the data, because you have those national reports telling us what is the general quality of the air in those countries. But if you go and if you dive deeper into those reports, then you will find that a lot of data is lacking. And I think that is the wrong messaging, and it's confusing not only the citizens, but also the scientific communities. And I think it's very important to be very transparent about how those data being collected, and what is missing, what should be done more, and what kind of support it's needed to increase the level of the monitoring and the level of the quality of the data. I've seen in the chat box there is the information regarding the data in Serbia, but I think that the monitoring of the data should be much more better than now. And however, I think when it comes to the talks with the policymakers and decision makers in the country, I'm not sure they really do understand how the air pollution from the scientific base side is really affecting the air pollution. We've seen as a whole, we had a lot of those reports published for the Western Balkan countries, and we've seen that the decision makers and been sending us the message that they really do respect our work, but they are not really ready to take the actions regarding the massive reduction of the air pollution. And that's very tricky way, especially what Garret said about those elections, and the decision makers being in charge for the 5 or 8 years only. So it's really influencing the way of the implementation of those policies and the strategies. And I think that in the future we need more knowledgeable people about the implementation of those strategies. And I'm so happy to see that the WHO is actually providing the knowledge and I guess financial support to the public health institutes in the region, actually giving them a chance to learn more about those analyses and also how to communicate the messages to the policymakers and decision makers in the region. So I'm really hoping that we will have much more health experts and scientific people on board in the future to really tackle this issue and really to implement the green agenda and again the action plan for the implementation of the green agenda. So yeah, let's finger crossed for that.
So just to drill a little bit more, because you say air quality data must be better. I mean, air quality monitoring provides air quality data, and I fully agree. Yes, it has to be reliable, but we do have in many of the regions, countries, we do have quite good, reliable data. But you also were talking about the public health institutions and expertise. I think what is needed is also interpretation of the data, because not everyone knows by heart what does the average, the annual average of 35 micrograms PM 2.5 does to you. I mean, sometimes people do not know what PM 2.5 is, and 35 micrograms, okay, it's a number. Yeah, so interpretation of those numbers might be important. Next, Constanza, what do you think? What kind of evidence is missing and is needed for policy support?
Thank you very much.
You already mentioned this very important stuff about communication, but to communicate, you have to have something to communicate and not only tell them, "Ooh, this is bad."
Yes, exactly. Thank you very much. Yes, indeed. I definitely agree with Garret that data on the health impacts and especially the number of deaths is a very crucial and in a way emotionally connecting for people as a tool to communicate. But at the same time, I'm a little bit worried that from the experience of the coronavirus pandemic, it seems, at least in Bulgaria, that people do not care as much about other people dying as long as they are not the ones who are dying. And this is the point that actually worries me a little bit, that even this is not going to be enough to really push policymakers and the public in terms of forcing a change. But at the same time, I think that there needs to be interconnection between different data sources. So not just level of pollution, not just mortality connected to pollution, but also what will be the benefits and other critical policy-making priorities, such as the pathways to decarbonization or share of renewables in the national energy mix, and other key elements that are not necessarily directly connected to air pollution, but just building the bigger picture for people so that they can really understand the issue and all of the other issues that are connected to it.
Yeah, so if you say pathways, if I want to translate it, do you mean the way out of the problem? Because you say, well, we can tell people thousands are dying, and I agree with you, people are getting, especially now in the corona time, people are getting, quite resistant to those numbers. It's like in communication principles. I mean, if you talk about deaths of 2 persons, then you have a tragedy. But if you are talking about 2,000 or 20,000 people, you have statistics. And
exactly.
I'm a little bit afraid that we are in the statistics domain because we do have thousands. We cannot say, oh, Mr. Jones or Mr. Światlicz or someone died of air pollution. We cannot point the finger. We can point the finger about corona. And even this is stopping, is already not, making people. But what is important, what you use very importantly, the West Pathway, way out of the problem.
Yes.
Would you agree that there is something which we need to show, to say that it's not so hopeless?
Exactly.
People know how to get out of it. Stefan, you are the next on the list, and you can talk about also convention experience, convention from a quarter, no, how many years now, 40 years of the convention. Part of the work is to provide advice, technical advice, how to get off the problem, out of the problem. So we are not in front of the black wall and we only despair about the problem. We know how to get from it. Is it the case? Stefan, please.
I mean, well, one of pointing out some past successes, one of the key drivers here was the recognition of the importance of collaboration. And I would argue, again guesstimate that also for Southeastern Europe, there is plenty to gain from mutual beneficial actions. So in order for the countries to, well, be open for the fact that domestic emission reductions will benefit your neighbors, and your neighbors' emission reductions will benefit you as well. And I would argue that that was one of the key successes of the Air Convention work, that they were actually international collaboration. Again, it was of course a completely different environment. It's a Cold War environmental agreement, so there were reasons for the success from that aspect, but the transboundary part of the air pollution and the transboundary part of emission reductions were definitely important. So the importance of cooperation on these issues and joint strategies, etc., etc. That I think was one very important part that we haven't talked about yet. But on the missing evidence, I do believe that the what to say, I agree with Garret, of course. The mortality is important, the morbidity is important, the days you have to stay home from work is important as well. But it's also important, I think, to remember to use the communication metric depending on who you're talking to. Again, so here I come back to these issues, what I presented or what I talked about with the cost in terms of effects on economic growth. When you talk to the finance department, I'm sure that they are interested in this. So they would want to know the money number. But the public in general, of course, yeah. If my relative who has bronchitis or has asthma or something like that, if all of us have relatives who are old or who have some pre-existing conditions, they will want to know these numbers as well on their morbidity and mortality. But I do think that we need to tailor this a bit, and we need to talk more effectively to finance departments, those holding the purse, basically, to be able to communicate in a way that the audience in each case will listen to. That's what I think why I argue that there's a missing piece in this benefit assessment, because and I know I read through your presentation again, Sergio, there, that it's important that this cost benefit analysis isn't only in terms of the technical cost, but you also need to take in the healthcare costs as well as the individuals, as we willingness to pay is a term we call. Basically, the appreciation you have of being healthy in monetary terms, that needs to be up there, at least when you speak to those who hold the purse. And yeah, I hope I were able to give you some decent answers or my point of views, Michal.
Yeah, yes, I think this a financial assessment or monetary assessment, which is in some cases in European Commission, for instance, is mandatory step in the procedure of proposing legislation, is very important. The problem in communication which we face is that until now, most of the estimates are based on estimates of health impacts are based on mortality impacts on mortality, increased mortality due to pollution, and this translated with in economic terms by using value of statistical life or value of a life year. And it is difficult to communicate, I know from experience. People just don't believe that an individual life is worth 2 million US dollar, 2 million euro in Southeastern European region, and in many other countries too. It's a lot of money. It's too many zeros. But it is true, and that's why in this cost benefit analysis, it really counts. If you put those numbers, if you say what part of GDP are those costs, it really is very big number, and then costs of even those subsidies which we put on coal seem to be small. And
Could I just add? I forgot one thing.
Just one sentence more. But I want to tell you that WHO and some people are working on supplementing this assessment by better estimates of morbidity costs. So utility costs. So really parts of the budget of the Ministry of Health, which goes to treatment of people sick because of air pollution. So we hope this will be easier to perceive and easier to say, okay, this part of the hospitals is taken by people sick because of, I mean, we know that around a quarter, 1/4 of the cardiovascular disease is related to air pollution exposure. If you say 1/4 of the cardiology department beds could be saved by reducing pollution, this is something which has very strong communication power. Daniela, you are next speaker. So you tell us, and you have your hand up. So tell us what type of evidence you think is missing or not sufficiently exploited. And also talk about your hand raised. Please go ahead, Daniela.
Yeah. As a matter of fact, I had another ideas, but after this few intervention, it seems to me that even it's not so big issue. Do we have evidence or not? But it's more an issue how we are going to communicate and who is going to communicate. I have a physics as a background, and when some people mention me, some few years ago that communication is a science, I was, communication is not a science, And then I realized and learned that as a matter of fact, communication is a science, So I think that it just came to my mind, that in those countries, the problem is, or could be, one of the problem identified, that as a matter of fact, that the people who made analysis and come to results maybe are not a good choice to present those results, because you could be the best in physics, but that doesn't mean that you're going to explain that to ordinary people in an appropriate way, And then when it comes to this information, I just realized while you were speaking that maybe, the good approach would be to present additional costs and additional mortality. And, because, even the governments do not care. When you say to the government, okay, you are going to be responsible for additional 1,100 lives, I'm not sure that that is not something that the government is going to react because they're afraid that the people are going to react, So those two things I just wanted to mention. And, in addition, somebody mentioned, and I really think that, even if we have, because we have a lot of policies, we have a lot of legislation. Sergeant mentioned in his presentation that this air quality program rely on climate change strategy, What is the fact in the most of those countries? Even the legislation is done, prepared, even the policies are prepared. We have mostly two situations. One is that those are not approved by the government and the parliament. That is the case of climate change strategy from 2018, I think. And the second case is we have adopted the main law, and then there is no implementing acts. And then we do not have implementation. And then, which the mostly missing in these countries, in all of these countries, and I could sign that, there is no monitoring on implementation. And there is no understanding that policies are obligatory. you're going to hear all decision makers in those countries, I mean, you know, Western Balkan, that strategies are not, you know, something that is commitment, that is responsibility, and that is obligation. So I really think that these two things, you know, monitoring on implementation and understanding that, you know, the policy, as a matter of fact, is goal, you know, long-term goal, and then, you know, legislation give you steps to achieve that goal is something that even missing the more than, you know, evidence to be in use. So I will finish with this.
Yes, indeed, I mean, both points are very important. I think it was already mentioned that the communication of what and how and to whom it has to be adjusted. Stefan already mentioned that he would not communicate about millions of euro or dollars to general public, but to people dealing with the finances of the country or finances of the region would. Stefan, you have something to add on this?
Yes, I speaking of what we need to do, and the last time or the last times I've been down in Southeastern Europe, and what I think we need to acknowledge as well is my understanding that cigarette smoking is still quite popular in plenty of cities and countries in the Southeastern Europe, at least in Belgrade, where I've been most times recently. And I can see that having that many smokers in the city, that it's difficult to get appreciation for the way air pollution damages your health. But I think it would also be important in terms of missing evidence that put this in comparison to cigarette smoking. I know that of course you don't smoke because it's good for your health, but it's a good way, as Serjan mentioned, that people actually go around and think that air pollution only affects children. That's a fallacy, of course. But it's also important to recognize that when you have as many smokers as there were in Belgrade last time I was there, and unfortunately COVID has banned me from traveling, so I haven't been there in 2 years. But the amount of smokers in Belgrade in 2019, they will for sure have an argument for not caring. And if that's so, I think we need to address or recognize that in the countries where smoking is still very common, we need to recognize that it is and compare air pollution to smoking. So at least we can reach, or in a way, in some sort of way, reach the audience that can shake off air pollution arguments just because they're smoking. This is something I need at least to raise the issue of smoking, that I don't know how to deal with it, but if people are smoking as much as they did in Belgrade when I was last there, I think it's very difficult to get a clean air message through. That was basically my point.
Yeah, well, comparison with smoking is not always good, but there are 2 points here which I may comment. First is the fact that a lot of smokers will develop cardiovascular or respiratory disease, and this in this group where air pollution can make an additional problem, because we are talking about relative risk. So the multiplication of risk can be actually the most deadly to the smokers because they already have some stages of the disease of interest. So it's bad news for smokers. But the second thing is that even if we see in a population large proportion of smoking people, there is majority of non-smokers. And while smoking is to a large extent personal decision, especially to start smoking and maybe to stop smoking, but being or not being in a polluted place is not a choice of each person. Okay, you may say, okay, go in the mountains, live in the on the top of the mountain, be in the clean air. Well, easier said than make it. Yeah, so it's not a choice, not a personal choice. Some similarity to cigarette smoke is with the avoidance of secondhand smoking. And surprise, surprise, in most of the countries, and from what I remember, even in the Balkan countries, there is no smoking inside anymore, or very much reduced. Well, I am lying if I don't remember a bar where people were not smoking. Yes, they were smoking, but windows were open. Okay, but something which like 20 years ago appeared to be something impossible became a rule in all Europe. You don't find people smoking inside in restaurants and bars, which was common 20 years ago. So things really changed. We have a few minutes so thank you very much for your interventions. We have a few minutes for a couple of questions. We have only two in the questions and answers at this moment. I will start with Aaron Cohen question, who asks the very relevant question related, part of the evidence, which is the evidence on the groups which might be actively preventing improvement of air quality because this might be against their interests. And there's a number of people involved in energy production, people who may be afraid of losing jobs or having their jobs conditions deteriorated by, for instance, by moving to cleaner energies. So there is something which we need to know, and also in communication with people, because there's a group of population which may be the most active against the action. Do you have any comments from the local situation? Daniela, Constanza, or probably Constanza may be the most relevant to this. Do you experience some pressure from the interest groups?
Yes, well, first of all,
how big is this pressure? How big is this group? How difficult is this problem, which is an obvious problem in many countries?
Yeah, so regarding how many people are employed in the energy sector, at least in Bulgaria, it's tens of thousands of people. And what needs to be pointed out in this respect is, at least for European countries, it's the availability of the Just Transition Fund, which at least for Bulgaria, we could benefit from 1.2 billion euros of funding that will be directly for tackling the negative economic impacts of the low carbon transitions in carbon intensive regions. However, in Bulgaria, the problem is that we are really late in preparing the just transition plans for these regions. So there is definitely a problem there related to the lack of strategic vision, again, of how to spend this money best, and then in really taking action to design this policy and start implementing it, because we currently don't have a plan for any of the core regions, and we still don't know when we can expect them. So this is a very big issue that needs to be also put together with air pollution.
Right, but what you identify here is actually you recognize that there is a problem, and of course the issue of people in endangered occupations must be addressed. The same as people as the problem of energy poverty. I mean, people who are using coal or wood for heating, and well, they must be heating their houses. I mean, nobody says stop it, yeah, but there must be a plan how to get out of it. And so we are not in front of the wall, but we have a tunnel, and there is a light in the tunnel because there are some, in the European Union at least, there are some assistance plans, because also on high level it has been recognized as a problem. So I want to address the other question. The question is, Claudio Bellis writes, I agree that scientific information is the basis for an effective policy. Nowadays, the policymakers do have access to environmental information of relatively good quality. Of course, there is always space for improvement. However, the lack of action may be rather due to economic issues or conflicting interests. So we address conflicting interests and economic issues. How would you address this question? At the end of everything is indeed money for action. Are you, Krzyzan, when you talked about your plan, national plan, was there any discussion about money for implementation? We already heard, I guess, from Daniela that there is lack of monitoring. So is it plan created to be put on the shelf? I have seen plenty of such plans, or there is really a plan to implement it, monitor, and for this you need money. Has this issue of economic issue been discussed in the plan?
I hope that this air protection program is umbrella document which will lead the further transition in the Republic of Serbia, and I hope that the other countries in the region will follow the same example. But however, also I hope that this program will bring more money from the international audience and will help Serbia to transition through the energy transition and coal phase out, which is really important. And we do consider the people's lives, and we do understand that we don't want to see those communities being left behind, and we do understand the vulnerabilities of different populations across the region. And we do understand that much more have to be done in terms of listening to the communities and to see how the country can help them in transitioning through all the process that we have. And one of the things that we didn't mention here today, and I think it's very important, and it is about the monitoring in terms of the implementation of the activities, but the inspection work and the penalties, which are not really the thing that we hear the decisions makers speaking a lot. And we know that we do support that polluters has to pay. But unfortunately, when it comes to the implementation of the laws and bylaws, we're seeing that the decision makers and those in a high level of in charge, they are not really happy to see that those industries or the coal sector shutting down. I guess it's because of the economic situation. But however, once we have the implementation of the laws and the inspection work, I guess that we will have a massive change in the region, and those organizations advocating for the better air quality also do highlight that the countries are lacking the transparency in the implementation and the budgeting. So I fully agree with Daniela, what she said about the development of the programs and not implementing all of them. I've seen that we're discussing a lot of in the chat box, and I'm so happy to see that we mentioned that someone mentioned that there's some things are required by law to do, and we know that that unfortunately we don't see those reports available. I do understand that we are lacking in the capacities, in the knowledge capacities, and also when it comes to the number of people being deployed to do the assessment of the air pollution. But however, I think that much more have to be done, and that the country needs to really invest a lot of money in really a huge assessment of the impacts of the air pollution. And I'm glad that you mentioned that the costs of the health costs, and we as an organization is reporting about those costs, and sometimes people do not understand what those costs are, and the diagnostics of the disease is really important. It's really costly. So I think that we need to more explain to people, to general audience, what these health costs are, and to better understand that the citizens are paying a lot actually and actually the countries are providing the subsidies to the polluters, and we know that the country is providing a lot of money to the coal sector, and this money comes from the our pockets. So I think that the huge change has to be done in the countries regarding the decreasing the level of air pollution, and to ensure that the sustainable and healthy future is there for the future generation.
Thank you, Serjan. It's actually a very good summary of our discussion. We will need to finish it, and I will need to hand over this. We have heard in our discussion about what is available, what is missing. A lot of evidence is there. There are some plans, and making the plan is certainly helping to put this evidence together and to identify what is missing. But we also heard that having a plan is not sufficient. We need to communicate the plans. We need to explain to all stakeholders what it is about. And I think what was also important was to say what the stakeholders, each of them, will gain from the plan. So of course, there will be costs, but there will be also benefits, and the matter of calculating this is also an important piece of evidence which might help in pushing policies through. So this all in the nutshell. The subject is of course much bigger, but it's time to finish this panel discussion, and I hand it over to Ryan. Thank you very much. Thanks to the panelists. That was extremely interesting discussion. Thank you.
Thank you, Michal, and thank you to all our speakers and panelists, not only for sharing your rich experiences and perspectives on how evidence can inform policy on the regional, national, and local levels, but also for your hard work and dedication on this topic. It's clear that there's still work to be done. Hopefully these conversations will serve as drivers in building interdisciplinary and cross-regional collaborations and further increase the evidence base, and also improve integrated communications, as was discussed, to effectively inform air quality policy and action in the region. We want to thank Garret and Michal for guiding us through today's webinar and leading stimulating discussions, as well as all of the attendees here today for sharing your time and questions with us. The webinar slides and recordings will be available on our website soon. The slides and recordings from our previous 2 webinars are already available. Before we end this webinar, I would be remiss not to thank our co-host, the Center for the Study of Democracy, and HEAL, for their help in developing the webinar, and specifically thank Konstanza, Serjan, and Vlatka Matkovic from HEAL, and Michal Krzyzanowski. And finally from HEI, Hannah Bogard, Palefi Pant, WACFOM, and our communications team. And then, as you can see from this slide, please stay tuned for the launch of our interactive database, as well as the publication of our upcoming reports and related events. Those are scheduled between March and May. And we also want to inform you that ISE will be hosting a networking event for Southeast Europe researchers. So please check their website for the date and details. That should be upcoming soon. In closing, thank you all so much again for joining us, and sending all very best and healthy wishes. Thank you.